Imagine a patient referred as CIDP because they have a progressive demyelinating neuropathy. But when you look more carefully, they also have skin pigmentation, edema, splenomegaly, thrombocytosis, and a small lambda monoclonal protein. That combination should immediately make you think of POEMS syndrome. POEMS is a paraneoplastic plasma cell disorder with multisystem involvement. The name helps us remember the major features: polyneuropathy, organomegaly, endocrinopathy, monoclonal plasma cell disorder, and skin changes. The key thing to understand is that this is not usually disease caused by bulky myeloma infiltration. Instead, there is a clonal plasma cell disorder, usually lambda-restricted, meaning the abnormal clone produces lambda light chains. This clone drives excess cytokine production, especially vascular endothelial growth factor, or VEGF. So the mechanism is clonal plasma cells, increased VEGF and inflammatory cytokines, vascular permeability and endothelial dysfunction, neuropathy, edema, organomegaly effusions, and skin changes. That is why POEMS looks so systemic. It is not just a neuropathy. It is a whole-body vascular and cytokine-driven syndrome. Clinically, the most important feature is the polyneuropathy. It is usually progressive, symmetrical, painful, and sensory motor. It often looks demyelinating on nerve conduction studies, so it can be mistaken for CIDP. The MRCP trap is that CIDP should not cause organomegaly, endocrinopathy, skin changes, papilledema, or sclerotic bone lesions. If those systemic features are present, think beyond CIDP. The organomegaly may include hepatomegaly, splenomegaly, or lymphadenopathy. The endocrinopathy can involve hypogonadism, hypothyroidism, diabetes, or adrenal dysfunction. The monoclonal protein is usually IgA or IgG lambda, and the skin changes may include hyperpigmentation, hypertrichosis, hemangiomas, or white nails. Other clues are very exam relevant. POEMS can cause papilledema, peripheral edema, ascites, pleural effusions, thrombocytosis, polycythemia, and sclerotic bone lesions. Pause here. Sclerotic bone lesions are important because they contrast with the lytic bone lesions classically associated with multiple myeloma. So, when should you suspect POEMS? The key clue is a patient labeled as CIDP, but with systemic features. In MRCP, this is often the pattern: progressive neuropathy plus organomegaly, endocrine disturbance, lambda monoclonal protein, skin changes, or unexplained edema. The investigations are aimed at proving both parts of the syndrome, the neuropathy and the plasma cell disorder. Serum and urine immunofixation, along with serum-free light chains, help detect the monoclonal protein. VEGF-F is often raised and supports the diagnosis. Skeletal imaging is used to look for sclerotic bone lesions. Nerve conduction studies and EMG usually show a demyelinating neuropathy with axonal loss. Bone marrow assessment helps define the plasma cell clone. The management principle is simple. Treat the underlying plasma cell disorder. If there is a localized sclerotic bone lesion, radiotherapy may be appropriate. If the disease is more disseminated, systemic therapy is used, often with regimens such as lenalidomide and dexamethasone. And in suitable patients, autologous stem cell transplantation may be considered. The mechanism of treatment mirrors the mechanism of disease. Suppress the plasma cell clone, reduce VEGF and cytokine production, improve vascular permeability, neuropathy, and systemic features may improve. So the exam message is this: POEMS is a lambda-restricted plasma cell disorder causing a cytokine-driven multisystem syndrome. Do not confuse it with ordinary CIDP. The key clue is demyelinating neuropathy plus systemic features such as organomegaly, endocrinopathy, skin changes, edema, thrombocytosis, polycythemia, papilledema, or sclerotic bone lesions. A quick recall question. A patient has progressive painful sensory-motor neuropathy, splenomegaly, hyperpigmentation, raised VEGF, and an IgA lambda monoclonal protein. What is the diagnosis? The answer is POEMS syndrome. And another: what is the important cytokine driving vascular permeability in POEMS? The answer is VEGF. If you remember one thing, remember this: POEMS is not just neuropathy with a paraprotein. It is a paraneoplastic plasma cell disorder where excess VEGF causes a multisystem vascular syndrome. Do subscribe to the channel for further videos.